There's some really, really important tips for making life easier for your client and for you. And it may not seem obvious, but the most important thing is be relaxed. If you're relaxed, your client will be relaxed. So make sure that your breathing is smooth and even, you're not hyperventilating, you're not rushing around. Take your time and be relaxed. The second thing that is really helpful is actually show that you care and you mean it. It's important to you as well as them that they should have good oral health. So if you're positive and caring, involved, make it fun, make it enjoyable, the job will be much, much easier. One of the best ways of showing plaque to make it easier to brush is to use some disclosing tablets. You can buy these in any chemist or a supermarket, and what you do is you ask your client to crunch up one of the tablets, and they crunch it around their mouth, sloosh that around the mouth, and then spit out, and that will show the plaque either blue or red, depending on the type of disclosing tablet you buy. Now that's great, it's all very well and good if your clients can crunch up tablets and rinse and spit out, but not everybody can. So there's an alternative, and the alternative is to use disclosing solution. And a really good and inexpensive way of having disclosing solution is to use food colourings. Just pour a few drops into a tiny cup, an egg cup perhaps or something like that, get a cotton bud, and then just wipe that over your client's teeth. It will show the plaque, disclose the plaque, and it makes it much easier to see, and as long as you can see it, then it's much easier to brush off. Because these are food colourings and they're dyes, there's a couple of things you need to be really careful about. One is, do make sure that your client isn't allergic or likely to have any reaction to some of the E numbers, so check that out when you buy them. And if you spill this stuff on clothes, it will stain. So use a paper napkin or some kitchen roll or a towel of some sort, just in case any gets spilled, to keep it off people's clothes. If you stain the sink or something like that with them, you can clean it up with a bleaching agent of some sort. One of the really important safety features of brushing somebody's teeth, especially somebody who can be quite challenging, particularly somebody who's non-verbal, is that you need to pick up on their body language, their cues, and they need to pick up on yours. So if you're relaxed, hopefully they'll relax. But if you're brushing somebody's teeth and they suddenly get tense, and you can feel the muscles in their face get tense in their neck, that's a sign that they're not happy about what you're doing. Now, for somebody who's non-verbal, they're not going to say go away. They might lash out at you or they might push. So you need to pick up on that tension and think there's a problem here. Try and relax yourself, make sure you're relaxed, because if you're not relaxed, they'll be tense. But if you relax and they don't relax with you, then it's a really good signal for you to back off, get out of their personal space, move away and assess the situation. Is it appropriate, say, to go back and carry on, or do we need to stop now, go away and do something different, then come back? Or perhaps use a different approach for toothbrushing. So do pick up on those non-verbal cues. Now, touch is another thing. You have to touch somebody when you're brushing their teeth, and there's appropriate touch and inappropriate touch. And you need to know what is appropriate touch. There's lots of different ways you can practice it, but if you do something like a light touch like that, it's inappropriate, it's unpleasant, and it can give very mixed messages. If you tense up and give a hard touch, or hold somebody, that can be quite threatening and is verging on restraint. And there are huge issues around that, and it's not appropriate. So you need to know what isn't appropriate touch. And one of the ways you can do this, which might sound a bit strange but is a bit of fun, is practice handshaking with people. If somebody shakes your hand and it's a floppy, sort of wishy-washy handshake, it implies that you're not confident and it's not pleasant. If somebody squeezes too hard, apart from that it might hurt, it's not pleasant. So the next time maybe everybody's at a staff meeting or there's a group of you together, go around and practice shaking hands. You might all have a laugh and a giggle about it, but then you'll actually learn what appropriate touch is, and learning should be fun. Another tip for somebody who is relatively cooperative about letting you brush your teeth, but will only let you do it for a few seconds at a time, is to adopt the stop-go method. So when they're sat down and they're still, you carry on and you brush, and then when they get up, obviously you have to stop anyway, but you stop. If you're really clever, you'll sense them getting tense by their non-verbal communication, by their body language, and you'll stop just a second before they get up and walk off. Let them get up, let them go away, walk around the room, come back, sit down, pick up again, and go from there. Hopefully, if each time you brush and people get a benefit from brushing, they feel better themselves, they're rewarded by you being pleased with them, then maybe they'll be able to sit still for longer at each interval. In the interim, until they can sit still for long enough for you to do all of their whole mouth, then it's really sensible to actually make a chart of the 6 areas of the mouth. And if somebody sits down and you brush this bit, well, you tick that bit of the chart, go away, come back later on, brush the next bit, tick that. And so you don't miss any areas of the mouth. You may not get it all done at once. You may do certain parts at one time of the day and the other bits at bedtime, but hopefully within a 24-hour period, somebody will have every area within their mouth brushed and cleaned, and that's when the chart's really helpful. It's not just a visual aid to you and the other care members, you know, if you change your shift and somebody's coming on later on, it's also a visual reminder to your clients about which bit needs to be done next, and hopefully things will improve with time and confidence.